We are working through our paradigm, and here we are in our second paradigm of treatment. We're going through each of the side effects that our patients may experience. As we go into our next side effect, dysgeusia, or loss of taste, is a huge deal in our patients' ability to maintain their appetite, to continue to desire to eat and drink. It is significant in their overall maintenance of their nutrition and their hydration. So, why do our patients experience dysgeusia? Well, let's draw our body for a moment. So, we have our patients here in their head and their neck. Now, this is our lateral view. The tongue has taste buds. The fields of the radiation damage the taste buds of the tongue. Next, the palate, hard and soft, play a role. Those areas and that region may also have cells that are damaged during the radiation treatment. As we move into the tongue, as we move into the palate, then we start to talk about the mucosa and the lining of the cheeks. Again, those taste receptors and our abilities for our patients to receive data input of, this tastes really good, is damaged. That is what radiation does to that region. One of the barriers is that the saliva within our patient's oral cavity is again changing at the ends of weeks 2 and 3. As the saliva changes, so does the taste. Consider as well when we reach and kind of smell, those regions during our treatment may be impacted. We believe that smell in the olfactory sense has a positive outlook for our ability to want to taste things. So, when can we start to tell our patients that they are going to experience this side effect? It is pretty cohesive with the saliva changes. Around weeks 2 to 3 during their treatment, they are going to begin to experience some of the side effects of the loss of taste. The challenge, it will peak and it will worsen weeks 4, 5, 6, and 7. As the treatment progresses, taste buds worsen because they are receiving additional damage to those cellular changes. When the taste buds change, this will persist and last anywhere from months for lifelong. So I tell my patients, you're going to get worsening taste starting around the 3rd week of treatment. I usually tell them when they come in the office and they start to report it. So I'm not kind of flooding them with this because every patient honestly is different. So as a patient says to me, I feel like I can't taste anything, or nothing tastes good, or it's too salty, or chocolate tastes disgusting, meat doesn't taste like meat, then I start to share with my patients, okay, well, that's going to get worse. So once they start that side effect, I usually tell them it will get worse, and it's going to last for months after their treatment. I say, when does it, because you're always going to be asked, when does it get better? Most of our patients, around 3 months following their treatment, so we like to say 3 months post, you're going to see a slow upward tick in improving in their taste. Weeks 3, 4, and then now we're moving through months. So I say 1 month at a time, things will get better. So month 4 will improve. Month 5, you'll have slight improvements. Month 6, all the way through 12 months, 1 year from the stop date of your treatment, we expect the taste buds to improve. What are some things that will cause our patients significant challenges? Oftentimes acidic fruits, oranges, salty things, believe it or not, chocolate, anything that has a really spicy hint to it. Salsas, those tend to potentially burn our patient's oral cavity when you combine those. But the loss of taste is going to be a lifelong change and it significantly causes barriers and them being able to maintain their weight, returning back to eating and drinking. I just had a patient in the office this week who is now 2 months post-treatment, and ability to swallow is looking pretty stinking good. But due to the loss of taste, their desire to eat and drink is slim to none. So in these cases, my goal as a speech pathologist is hopefully continue to, if there is a feeding tube, get rid of that feeding tube through drinking their calories so that they can slowly continue to think returning to eating. Or I am going to, if there is no feeding tube, continue to encourage that they don't give up on this and that basically educate them that every month these things will improve. And so you're in the recovery process. But we expect dysgeusia, loss of taste, during treatment. Around weeks 2 to 3, it starts. It heightens and worsens every week through the end of your treatment, and it remains bad until around the 2nd or 3rd month post-treatment. Then you'll start to see an upward improvement for typically around 12 months. At 1 year post-treatment, I share with my patients that that's sort of a new normal for them. So this guide can be valuable in keeping your patients moving forward, clear expectations, as well as vocabulary and language for them.